Hi guys, it's Trev, body mechanic from Absolute Fitness, and today we're looking at adductor tendinosis. Now tendinosis is quite common and it affects everyone from athletes to Joe public. It's highly likely at some point in your life you will suffer with a form of tendinosis, and when we do, it's generally caused by a repetitive action which has been done over an extended period of time. I've had it. We've often heard of tennis elbow or golfer's elbow. They're tendinosis around the elbow. I got that through spending all day shoveling. I was digging a pile of soil and throwing it back into a previously dug hole which I'd used the digger to dig, but I'd had to get rid of the digger, so I was having to throw it back in, and that continuous motion of doing that all day, by the end of the day I'd developed tendinosis in my elbow. So at some point it's very possible that we can get it. It was traditionally categorized as an inflammatory condition, but it is now seen as a degenerative process now. Now, adductor tendinosis of the upper leg or inner thigh muscles is usually a chronic injury resulting from repetitive strain on the muscle origin. So that's where it actually starts from. Causes micro tears that do not initiate a bleed. Therefore, they don't initiate a repair process. It will typically start off mild, and unless you treat it, it will progress and can lead ultimately to the loss of function because of the pain. The pain becomes too much. So you shy away from using it. So, identifying it. Well, if you touch it, we palpate it along the muscular tendinous origins, so where it starts from, in this case the adductor muscles, so we're feeling that pubic bone down in our private region right in, because you're trying to get onto the inferior edge, the underside of the pubic bone, and if it's painful to touch, then you've got tendinosis there. So what's the treatment for it then? Well, usually anti-inflammatory medicines is our first protocol. Physical therapy in the form of massage, stretching, TENS unit, which means transcutaneous electrical nerve stimulus, and active strengthening of the hip muscles. All these things need to be done. If that doesn't work, then you're going to have a corticosteroid injection. And if that doesn't then work, you're looking at surgery, because like I say, they are microscopic tears to the muscle, the tendinous muscle, or the tendinous aspect of the muscle, and where it joins the bone, and it won't repair itself because it doesn't bleed the tiny microscopic tears. So burning question, how long are you out for? How long is it before you can return back to action, back to work properly? Well, you can return to training or back to work properly once your symptoms have subsided, and that can take anything up to 6 months depending on how you treat it and how quickly you start treating it. So it's quite a severe condition. Tendinosis in any aspect of the body can be painful, and if we don't treat it properly, then you're going to be suffering with it for a long time. Watch out for us next week. Our topic is one very close to my heart, osteoarthritis, and we'll dispel a few myths with that as well.